Breast augmentation surgery is surgery to increase the size of the breast. In my practice, there are two groups of women who come for this sort of surgery. The first is usually a younger woman with small breasts who just want them enlarged, and a second group, usually after childbirth, where the breasts have shrunk a bit after breastfeeding, for example, and they just want them restored to how they were beforehand.
Fortunately, treatment for breast augmentation is fairly straightforward. Treatment involves inserting breast augments or silicone implants into the breast, which enlarges the size of the breast.
The treatment isn't particularly painful. Most patients say that they just feel the breast a bit tight and uncomfortable, and is usually managed with oral analgesia alone. In addition to this, the choice of implants varies. You can either use a round implant, or you can use an anatomically shaped or teardrop implant.
One of them that we use commonly in Britain is the round implant. So these implants have got a round base and they're round in shape. And the second implant is an anatomical shaped implant or a teardrop shaped implant. Now in this implant, as one can see, the maximum projection is where the nipple sits. So the maximum projection of the implant is where the nipple sits. The teardrop shaped implant gives a more natural result in the breast augmentation operation, while the round implant gives better filling out or better fullness in the upper pole. Now, which implant a patient wants is really a very individual opinion. Now, some of my patients want an implant that's round in contour, they want more upper pole fullness. But the other patients often want a result that is more natural in shape. You usually need to spend one night in hospital following breast augmentation. My patients usually go home the day after surgery, and they see me back in a week or 2 weeks, and finally again in 6 weeks following surgery. The recovery following breast augmentation is really about 2 weeks. I encourage my patients not to get back to work for 2 weeks. Following that time, by which time the bruising has come down, patients are encouraged not to do strenuous exercises like swimming or anything that involves repetitive movements of the upper arms for 6 weeks. The scars following breast augmentations are under the breast, or submammary as they're called clinically. So they're under the breast, and very rarely are they visible as they fall into the fold under the breast.